Subtalar joint, the body steering wheel. You can see how it resembles a steering wheel as it goes into inversion and eversion, or supination, pronation. Right here you see inversion and eversion, turning of the arch down. To treat, I take my dominant hand and web over the subtalar joint. My non-dominant hand comes over that to brace. When you're going to mobilize a joint, you want to decompress first. I take Kyle's foot and put it between my knees and drop my body weight back to jostle the joint a little bit. Reposition again and jostle a little bit to decompress. And then I start to rotate my hips side to side to look for restrictions in the subtalar joint. If I find a restriction, for instance, the foot won't go into supination, it's pronated or flat-footed, I put the client on their side and I pull the toes back into plantar flexion, and I take my soft fist and start to sweep down the arch. But first I ask the client to pull the toes toward the nose and I resist. When he relaxes, I sweep slowly down through that arch to try to stimulate tone in the arch elevators. After we finish the hands-on work, Paul Kelly comes in and starts to retrain Kyle's pronation problem by taking him into pronation to activate the arch elevators, tibialis anterior, posterior, peroneus longus. Then he wants to strengthen by taking him onto a TheraBand wobble board or wobble disc, and by balancing on one foot, which is pretty hard to do for a beginner. Sometimes they have to hold on to something. It starts to create better proprioception, better balance through the midbrain and cerebellum. And it also really is great for strengthening the arch elevators and correcting problems with the subtalar joint. So you can find this technique and many more from my Motion is Lotion e-course with Paul Kelly at ericdalton.com. Thank you.